If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker and then I'll get back to it.
Gold Bond knows that when your skin feels good, you feel good. So look after it day and night and make Gold Bond Healing Lotion your go-to. It's clinically shown to visibly heal and moisturize dry skin in just one use. We all deserve soft, healthy-looking skin every day, so choose a trusted brand with proven results. Gold Bond Healing Lotion. Buy yours now at walmart.com.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Hi, I'm Dr. Raj, and welcome to the Med Prep to Go podcast. Our mission is to improve medical student wellness and reduce educational debt by providing a high-quality USMLE question bank in an online and audio format. By making medical education material available to study on the go, we strive to give you time back in your day to focus on your health and well-being. And we are going to go over 3 USMLE super high-yield questions. Today's category is going to be pharmacology. So we're going to do 3 questions. Is everyone ready? Cool. Let's get started. So we have a 24-year-old man presents to the emergency department with fever and a sore throat for the past 5 days. He denies any sick contacts. The patient has a past medical history of an unknown mood disorder and was started on a medication to treat this 2 months ago. He does not smoke cigarettes, drink alcohol, or use illicit drugs. Vital signs are temperature of 38 degrees Celsius, which is 100.4 degrees Fahrenheit. Blood pressure is 102/70, heart rate of 107, respiratory rate of 14. Physical exam reveals an oral ulcer and tachycardia. Labs reveal the following. The leukocyte count is 1,500. Ooh. The hemoglobin is 14. The platelets are 330,000. And the creatinine is 0.9. Which of the following medications most likely cause these findings, including the labs and the physical exam? Is it A, carbamazepine, B, lamotrigine, C, lithium, D, oxycarbazepine, or E, valproic acid? And the correct answer is, it's A, carbamazepine. This patient is suffering from non-specific symptoms, but labs show leukopenia. Carbamazepine has a black box warning due to the risk of developing anemia or agranulocytosis during treatment. A spectrum of hematologic effects have been reported with carbamazepine, including agranulocytosis, aplastic anemia, neutropenia, leukopenia, thrombocytopenia, pancytopenia, and different anemias. Each early detection of hematologic change is important. Choice B is incorrect. Lamotrigine is an anticonvulsant and can cause Stevens-Johnson syndrome, which starts as flu-like symptoms, followed by a progressive rash that blisters. Leukopenia is not a typical finding. Choice C, lithium, is incorrect. Lithium is used largely in bipolar disorder to treat episodes of mania and would cause an increase in creatine levels. Lithium can cause nephropathy, chronic interstitial nephritis, nephrogenic diabetes insipidus. Definitely look for individuals who may be hypernatremic. Lithium does not cause leukopenia. Choice D Oxycarbamazepine is incorrect. Oxycarbamazepine is an anticonvulsant that is not used in mood disorders and is not reported to cause leukopenia. Choice E, valproic acid, is incorrect. Valproic acid is an anticonvulsant that can treat both seizures and bipolar disorder. Valproic acid can cause dose-related thrombocytopenia in some patients. Some studies have shown a range between 1 to almost 27% of patients. What is the learning point here? Carbamazepine can cause agranulocytosis, anemias, and other hematologic effects. Next question. We have a 16-year-old boy presents to his pediatrician for the evaluation of a growing rash on his scalp for the past 6 weeks. The rash is mildly pruritic. He denies sore throat, drainage from the lesion, or joint pain. His past medical history is significant for multiple ear infections as a child, which required bilateral tympanostomy tubes placement when he was 8 years old. He has otherwise been healthy. The patient does not use any alcohol or drugs. He is a sophomore in high school and plays on his school's junior varsity wrestling team. He does not take any medications. Vital signs, temperature is 36.8 degrees Celsius, 98.2 Fahrenheit. Blood pressure is 111/68, heart rate is 72, respiratory rate is 10. Physical exam reveals a 4-centimeter erythematous annular lesion on the left temporal scalp with central clearing and broken hair shafts. There is minimal overlying scale, and the lesion is mildly tender to palpation. No lymphadenopathy is present. No further rash is present on the body. And a KOH prep of the skin scraping shows thin, long tubes branching at acute angles. The patient is diagnosed with a dermatophyte infection and is started on oral griseoflavin. Which of the following is the correct mechanism of action of griseoflavin? Is it A, forms pores in the fungal cell membrane, leading to leakage of cell content? Is it B, induces cytochrome P450 activity? Is it C, inhibits beta-1,3-D glucan synthase? Is it D, inhibits ergosterol formation? Is it E, inhibits mitosis of fungal cells at metaphase? And the correct answer here is E. It inhibits mitosis of fungal cells at metaphase. This patient has tinea capitis, a dermatophyte infection of the scalp. Because topical antifungals do not penetrate the root of the hair shaft, tinea capitis must be treated with an oral systemic antifungal. Griseoflavin is a first-line oral antifungal for the treatment of tinea capitis and works by inhibiting microtubule polymerization in fungal cells, thereby inhibiting mitosis at metaphase. Answer choice A, forms pores in the fungal cell membrane, leading to leakage of cell contents, is incorrect. Ephedrine B works by binding ergosterol and forming pores in the fungal cell membrane. It's used for severe fungal infections. Choice B, induces cytochrome P450 activity, is incorrect. Griseoflavin is an inducer of cytochrome P450, but this is not the means by which it acts as an antifungal. Other cytochrome P450 inhibitors includes St. John's wort, carbamazepine, phenobarbital, phenytonin, and rifampin. Choice C is incorrect. Echinokinins, such as capsofungin, inhibit beta-1,3-D glucan synthase for the fungal cell wall. It is typically used for Candida infections. Choice D, inhibits ergosterol formation, is incorrect. Azoles, such as fluconazole, itraconazole, voriconazole, inhibit the formation of ergosterol. They are broad-spectrum antifungals. With the newer generations, an oral antifungal can also be used to treat tinea capitis. Learning point, griseoflavin is a first-line oral antifungal for the treatment of tinea capitis and works by inhibiting microtubule polymerization in fungal cells, thereby inhibiting mitosis at metaphase. And let's read our last question. A 19-year-old woman is brought to the emergency department by her father with complaints of trembling hands, excessive sweating, and confusion. Her symptoms began 3 hours ago and have progressively increased. She also had an episode of diarrhea an hour ago. The father reports that his daughter has been taken has been to the pharmacy a few hours before symptoms began, but does not know what she has purchased. Her past medical history is significant for depression, for which she takes citrulline every morning. She does not drink alcohol or use drugs. Vital signs are a temperature of 40.3 degrees Celsius, which is 104.5 degrees Fahrenheit. Blood pressure is 134/83, heart rate of 137, respiratory rate is 19. On exam, she is not oriented to time or place, but is oriented to speech. She recognizes her father. There is a diffuse muscular rigidity, and patellar reflexes are +4. On auscultation of the abdomen, increased bowel sounds are heard. The patient is given oxygen by nasal cannula, IV fluids, and intravenous diazepam. Intake of which of the following drugs is likely to have precipitated this patient's condition? Is it A, calcium docusate? Is it B, dextromethorphan? Is it C, fexofenadine? Is it D, ibuprofen? Or E, omeprazole? And the right answer here is B, dextromethorphan. This patient probably has serotonin syndrome, suggested by the rapid onset of classic features of altered mental status, autonomic instability, which is seen in diaphoresis, hypothermia, tachycardia, and hypertension, and muscular hyperactivity, noted with the muscle rigidity and hyperreflexia. Serotonin syndrome is caused by excess of serotonin, which is the 5-hydroxytryptamine, otherwise known as 5-HT receptor activation. It is usually precipitated by the simultaneous intake of 2 or more serotonergic drugs, but can also occur after the initiation of a single serotonergic drug in a susceptible individual. Its primary treatment involves supportive care and benzodiazepines. Patient can also be given the antidote, which is cyproheptadine. That's also a great board pearl. This patient is already on a serotonergic drug, which is sertraline, which is the generic name of an SSRI, select serotonin reuptake inhibitor. Dextromethorphan is a cough medication that can increase serotonin levels and cause serotonin syndrome if combined with another serotonergic drug, such as the SSRI. Choice A, calcium docusate, is incorrect. Calcium docusate is used as a laxative to relieve constipation. Although intake of docusate could explain one of the symptoms, patient's diarrhea, it would not be expected to cause altered mental status, autonomic instability, or neuromuscular hyperreactivity. Answer choice C, fexofenadine, is incorrect. Fexofenadine is a second-generation antihistamine used for allergies. It does not significantly affect serotonin levels and is not typically associated with serotonin syndrome. Choice D, ibuprofen, is incorrect. Ibuprofen is a non-steroidal anti-inflammatory drug used to relieve pain and reduce inflammation. Although it can have mild effects on serotonin metabolism, it is rarely known to cause serotonin syndrome. Choice E, omeprazole, is incorrect. Omeprazole is a proton pump inhibitor used to reduce gastric acid secretions, treat disorders such as peptic ulcer disease. They do not directly affect serotonin levels and are not typically associated with serotonin syndrome. Serotonin syndrome is characterized by the classic triad of altered mental status, autonomic instability, and neuromuscular hyperreactivity. It is usually caused when 2 serotonergic drugs are taken together. I hope everyone enjoyed these 3 high-yield questions for USMLE Step 1 or COMLEX Level 1. And if you want to read more about me, please look me up, Dr. Raj, on any social media platforms, or check out my book series published by Elsevier for USMLE Steps 2 and 3. Please check out my morning report, Beyond the Pearls. We have volumes in surgery, OB, ped, psych, medicine, and also I have my case report series where we have wonderful novels in talking about classic high-yield topics such as pathology. Hope you enjoyed this, and I'll see you during the next podcast.
This episode is brought to you by Marqeta. When it comes to your payments provider, you can't afford to compromise. Marqeta's modern payment solutions flex with your business without the trade-offs. Stable and agile, secure and innovative, scalable and configurable. If they say you can't have it all, don't believe them. Your business demands more. Choose a payments provider that delivers more. Choose Marqeta. Visit marqeta.com/Spotify to learn more.